Okay, good afternoon. It is September 17th, 2020. Mayor Mike Inman with you this afternoon from Macomb City Hall to bring you the latest in the COVID-19 pandemic here in Macomb and McDonough County. It's been several days since we've had an opportunity to sit down and share some information with you. So we do have quite a bit to share this morning, or excuse me, today. And so if you are ready, we'll go down that road. So currently, information from the McDonough County Health Department puts our current total cumulative case count at 431 total cases. And I would tell you that in the last 14 to 18 days, that's a near doubling of the total case count. And we know why, and we'll talk about some of that here in just a minute. Of those 431 total cases since the onset of the pandemic, currently there are 59 active cases being tracked by the McDonough County Health Department. Nearly 360 people have recovered, and we want to talk a little bit about convalescent plasma here in just a few minutes with that number of people in the community that have recovered from COVID, and then also 16 folks who have succumbed to the COVID-19 disease. So back to how that affects hospitalizations. Currently there are 3 people hospitalized due to COVID-19, and I would say that that doesn't mean they're all at McDonough District Hospital. Based on their testing taking place here, they may be seeking treatment elsewhere, but there are a total of 3 people hospitalized due to COVID-19. And at the end of the day, we're about a 4, well, our positivity rating is stable, we'll say that. Regionally, the number is about 6.5%, and again, regionally, we start running up against additional mitigation efforts from the Restore Illinois plan at 8+%. So a total of almost 10,000 total tests conducted in McDonough County since the onset of the pandemic. And so when you factor in the total number of tests versus the total number of positive tests, that gives us our positivity rating. And so again, locally it's stable, but we're still, we have to be diligent in monitoring that and doing what we can to continue to mitigate it. We know what those mitigating conditions, factors that we can control, face coverings, hand washing, social distancing, those should all be a part of our lives right now. However, I will tell you, just in my own personal experience, stepped out of the vehicle to go into a restaurant, got all the way to the door, forgot I didn't have my mask. So I had to go back to the truck and get it. So I understand we still need to remind ourselves, particularly in nice weather, and we forget about, sometimes for good reason, we forget about all the things going on. So again, remind yourself, have face coverings available wherever you go. They're still required. Don't see that changing in the foreseeable future. Some other things we want to share with you relative to the Go West system. They are enforcing with some vigor their social distancing requirements on our buses here that are operating within the city. Face coverings are required, so please adhere to those when you're interacting with the Go West system. And you know, we have some other ride-sharing programs that are in the community, Lyft, Uber, whatever. They're also requiring those things. So it's just a matter of part of our lives. And again, even though occasionally we all are apt to forget, we've got to remind ourselves we got to hold fast. So the largest number of cases that are coming back positive are from congregate gatherings, not congregate living. I'm not talking about long-term care facilities, things like that, but where there are parties. And if you remember, about almost 2 weeks ago, we issued an order in the city restricting gatherings and size in certain areas of the city around the campus. So even on private property, we're restricting the number of folks that can gather. And then those other restrictions regarding seated clients, seated patrons only at bars and restaurants is still in effect, and we'll be running through for another week here. We're monitoring closely to see if those efforts are having an effect on our case count. We're keeping close watch on those so that if we can ease those up, we will. If they need to be extended or some other mitigating factors need to be brought into play, we can do that as well. Just asking everyone to continue to do their very best. I understand there's a phenomenon out here called pandemic or COVID fatigue where generally as humans we're being a little worn down by this whole effort. I understand that. I sympathize, empathize. I suffer from it myself occasionally. The issues are, though, that this is for the long haul. This is more of a marathon than a sprint because as we're continuing here at the national level, there seems to be a continuation of this as we look into months down the road, and more importantly, as we begin what is traditional flu season. So a couple of things we want to share with you about that. We would strongly encourage you that if you've never gotten a flu shot before, this would be the year to get one. We are looking at historical data from internally within the county to see how many hospitalizations we would normally expect to see based on past admissions at MDH, to see what we might be looking at combining treating inpatient traditional flu patients and the possibility of folks coming in with COVID symptoms that require hospitalizations. So actively looking at those numbers, trying to assess those. And speaking of MDH, they'll be starting some flu clinics across the county here in the next 10 days. Go to their website, and that's here located at your screen right now, and you can, there'll be information where you can look to participate in those McDonough District Hospital flu clinics. Some are on campus at MDH, and then there'll be others spread throughout the city and the county, so there'll be a good opportunity for us to get vaccination for the current flu season. And I can't underscore enough how important it would be for you to get a flu shot. I know this will be the first time I will be getting it. I meet some of the criteria based on age, but very important. We don't, again, as we try to bob and weave and maneuver through this pandemic, anything we can do to minimize its impact, and one of them would be to get a flu shot. It won't keep you from getting COVID. That's not what we're suggesting. It will help prevent you from getting the traditional flu and whatever comes from that as far as you being exposed, and if you're not vaccinated, how that may affect your health and maybe ultimately require hospitalization for treatment. We want to eliminate that as much as we can. So some other things we want to share with you as well. The census will be coming to an end at the end of this month. We have a couple of events, last minute push, that are really going to be fun events to garner as much participation for those folks that still haven't had the opportunity to engage in the census count. So what should have happened already, you should have gotten several pieces of paper from the Census Bureau delivered to your residents, inviting you to participate. You may not have done that yet. You could have, should have had an enumerator, a census taker come to your door by now. You may or may not have been home or for whatever reason haven't participated. We got one last push we would ask you to become involved in, and there's an incentive. We were granted some additional dollars from the Census Bureau to put on one last event to garner as much participation as possible, an opportunity for you to participate in the census and eat free. And you say there's no free meal, well in this case it is. An innovative project from our census committee has engaged the local food truck vendors in the community that are licensed and appropriately certified to conduct retail sales at curbside out of a food truck. They'll be spaced all over the community this coming weekend. You'll be able to go to the downtown Macomb website, click on exactly where they're at in your neighborhood, go get a free bite to eat, literally a free bite to eat, and there'll be census personnel there to help assist you with participating in the census if you've not already done that. And then next weekend, there'll be another opportunity to do that at local restaurants in Macomb. All that information is on the city's downtown Macomb website. That's appearing on your screen right now as well. One last effort to get as much participation, because it's be so vitally important for the next 10 years about how much shared revenue we get from state and federal resources to help Macomb be a better place. So we're counting on you to help us with that, literally counting on you to help us with that. Also, for those small business folks in the community, you should have received some information from the Office of Community Development, Downtown Development, any number of places talking about the Business Interruption Grant Program, Phase 2, big. There were some dollars available earlier in the pandemic for this. This is the second round, $200 million available statewide. That information for our small business community is available on the downtown website, the Chamber's website. The application process actually opens up later today, probably within the next hour or so. So if you need help or get onto the website and you have some questions, please reach out to either Kristen Terry in the Office of Downtown Development, or John Bannon in the Office of Community Development, Lauren Merritt over at the Chamber, or Kim Pierce at the Macomb Area Economic Development Corporation, all willing, able to help you, walk you through that process to see if you may be eligible to apply, and then see about getting some of that grant money. Grant means don't have to repay necessarily. So another program from the state that we'd encourage you to make yourself aware of. One other thing, we've talked about 431 total cases, 59 still active, but 300 and almost 60 people have recovered from COVID-19 in McDonough County. And there's a treatment that's available that seems to have some effectiveness, where folks who have been exposed and recovered from COVID have antibodies in their blood system. And there's a convalescent plasma program, treatment program that's available, and through the Mississippi Valley Regional Blood Center, and that information is on the bottom of your screen now. If you're one of those nearly 360 people in the community that have recovered from COVID, we'd ask you to make some outreach to the Mississippi Valley folks, talk to them about arranging with them to donate blood and them collecting your plasma for treatment for folks who are suffering some of the more serious side effects of COVID-19 exposure. It's a real a potential lifesaver in many cases, so we'd encourage those folks that are recovered from COVID to take advantage of that. And again, that information is at the bottom of your screen now. Also remind you the McDonough District Hospital's drive-through testing facility is open. They're reporting a near doubling of the number of cars through there every day in the last 60 days. So back in July it was the mid-30s. It's now they're averaging around 75 individuals through the testing facility. They can handle that. I don't want to discourage you, think, oh my gosh, I've got to wait in line. That's not the case. It's a very efficient process. Even if there is a line, it's a very short wait, but their hours of operation are appearing at the bottom of your screen now. Again, you don't have to be symptoms, you don't have to have some suspected exposure, you just need to go there and submit to the testing. And we would encourage you to do that if any of that is, keeping you hesitant about the possibilities of maybe I've been exposed. This is a way of being tested. The turnaround time is around 31 hours, so about a day and a half. For the most part, that's not a long wait period. I know 2 people at my house have had the opportunity to get tested, and the turnaround time was really good. For one of them, it was very good and got results very quickly. So we'd encourage you to avail yourself of that, and again, those hours are at the bottom of your screen. I want to thank you for everything you're doing in the community. Again, flu season is upon us. Give strong consideration. Recommendation is to get a flu shot. Continue to wear your face coverings every opportunity you get. We know there's still plenty of good weather that you can get out and enjoy being outside, recreating, having fun. Still many opportunities to enjoy weather through our local restaurants that have outdoor seating, where you stand a much better opportunity to be free of the virus in an outdoor setting and still using face coverings as are mandated by the state when interacting with serving personnel there. Anyway, we know what we need to do. We would encourage you to keep doing the very best you can. We understand occasionally we forget. This is a friendly reminder not to forget, and until we have an opportunity to meet again.